Good evening, friends, from wherever you're watching. And this is the first of the recall interviews for this particular session of NEET-SS. Sorry, we're a couple of days late, but I think we've got a very interesting person with us this time. Rank 8, Taniya from Maharashtra, Nagpur, and been, I think, academically very good. Just completed her MD medicine from KEM. I think the process of completing just finished off with their exams and she's with rank 8. So we've actually had a lot of students like this, I think, last year, previous years as well, who on the trot complete MBBS, MD, were very disciplined with respect to their preparation, and they most often end up taking endocrine and rheumatology because those are the subjects they feel are in their domain or in their zone. And she herself, I think, is decided on the fact that she wanted to become a rheumatologist in second year of PG itself. So, congrats, Tani. And I think the opening question for you is that itself. Like, there are two schools of thought. And you shouldn't think about what you want to pursue when you do MD course, and then you should leave everything and then focus on the MD course only, and thereafter only think about this. Or as you have done, like midway itself, very clear about the fact that this is what I want to pursue. Do you think like thinking that midway is an advantage and it helps you further in your preparation?
Yes, I think it did help me. So basically, from which college I am in KM hospital, we get a lot of patients, rheumatological patients. So I
Yeah,
have seen a lot of SLE patients, vasculitis, and I
yeah,
felt very satisfied after treating them. So I decided that since I had so much interest in that branch, I wanted to pursue my super specialization in it. And
yeah,
because of that, I had a goal in my mind, and it helped me study better. Like I had become very determined that I will study very well during my second year and my third year as well. Of course, it was very heavy during my residency. It
yeah,
was very hectic. So in second year,
yeah.
I did not get that much time to study. But because of
Mm.
that, I think it because I had a goal in my mind, it helped me prepare better.
Yeah, I think this is a big lesson because most of the people keep talking about the fact that they don't get time to read during residency. And you have actually done your PG from the most hectic place in the country. I think if there is a competition to choose the PG course which is extremely hectic and most hectic, I think in the top three there will definitely be KM. So just about like there are people who choose MD. When it comes to MD, they choose a place which is less hectic, telling that they want to study more. So I think that's a completely wrong decision. What do you feel about it, having done from the most hectic place?
So I feel that this has been a blessing for me that I did it from KM, because I'll tell you what happened in NEET paper itself. So I did not get a lot of time to study in my second year. I got a bit more time, but less than the other colleagues, in other colleges. But I always took that positively, because the patients I saw in EMS and how we manage all the VTACs and all the cardiology patients, like different specialities,
Yeah.
it helped me so much that in NEET, when I was seeing the cardiology questions and ECGs, I was initially getting confused between two options. Like I was what I did was, in my GTs, I used to read the options first, so that I
Yeah.
get a hint of the question, and then I used to read my question. But in
Yeah.
NEET, what happened, options were confusing, so I decided whatever question is going to come, I'm going to see that this is a patient who has come to my EMS, and now I
Correct.
am going to treat this patient like I treat in my college. And I tell you,
Very good.
that approach helped me so much. And I did not read the options for the ECGs. There was an
Yes.
ECG, I could diagnose it, I could say that this is the next thing I'm going to do for this patient, and I chose
Yeah.
that option. And it was very easy for me that way. So I think a patient centric approach and that clinical acumen which I developed
Yes.
by seeing so many patients has helped me a lot, sir.
I think this should be spoken aloud, but unfortunately, many of the colleges don't give you that much clinical acumen, and unfortunately, only 10% people study this way. So that's why I think if everyone studies this way, then India would have actually got a lot more competent doctors and things would have been easy, I guess. Actually speaking, when you had that option to choose whichever college you wanted during your NEET PG, what actually drove you to KM? Just because you are from Maharashtra, or you had any particular reason? Because you knew right beforehand itself KM is tough. There are so many options. She got rank of 100 plus in NEET. I mean, around 100 in NEET PG as well. So, what do you feel at that time? What actually made you choose KM?
Yeah, so I saw a lot of colleges in North India, South India, as well as in Mumbai, Maharashtra. But I always had, like, I was very passionate about medicine. For me, it was
Yeah,
always about learning. At that time, I did not know that I'm going to do SS in any branch when I was
yeah,
choosing medicine. But I was so passionate that people told me that you will get a lot of admissions. It is going to be hectic. But
yeah,
all my seniors told me that जो वहाँ सीखने मिलेगा वो तुझे कहीं नहीं मिलेगा. इतने patients देख
correct,
लेगी that you are going to be an expert. And I always
exactly.
took it very positively, even though it was very hectic. But I got to learn so much, and I'm very grateful, sir.
That's awesome. I mean, you have now like cleared NEET PG also with a great rank, NEET-SS with a digit rank. think this is what most of the students aspire for. And like now that more than 70% of the students are girls, and I think everybody aspires for this. I can't ask you any kind of secret or shortcut or anything, but like if you want to share something that is unique about the way you study, because like, everybody at the end of the day actually wants this, but people who achieve this really don't know how they achieve this. It's just a mix of so many factors. But as a student who's been very disciplined throughout, and as a girl, can you just give a kind of a message, not a message exactly, but what you feel are like two or three tips, very very important to follow, because it's been at 9 years since you finished your, I mean, 9 years since you joined it, because our 10th year. So inside
Yeah.
10 years to actually join for DM is not a small feat. It is a fabulous thing. So can you just kind of share few two three tips?
Yes, sir. So first, I think the most important thing is your passion. If you're passionate about medicine, you'll love reading. Like I love reading Harrison. I love reading your notes. So I was very passionate about it. I never felt it was a burden on me that I'm preparing for an exam. I wanted to read it because I wanted to gain knowledge. Second thing I feel which has helped me a lot to prepare for my NEET is that in my second year itself, whenever I saw any patient, for example, when I saw PCP for the first time, I used to go back to my room and I read it from Harrison. I did that for all the cases. I still remember we had a patient of TMA in our ICU, and I opened your nephro notes in the Marrow app itself, and there itself I read it in short. And then when I came back to my room, I read it from Harrison. So whatever cases I saw, I discussed it a lot with my seniors, especially the ECGs, like D Winter's sign. I never knew before residency what it means, but in my
Yeah,
residency, when I saw a patient in EMS, I discussed it with the cardiologist there that what is this, what do
yeah,
we do, how do we manage. So all these things like helped me a lot to develop that good clinical acumen. I used to discuss all the cases actively with my faculty and my seniors,
yeah,
come back and read it from Harrison. So this is something which helped me a lot, sir. And even though I got a very little time between my university exams and needs, all these things I did not need like active revision for these because they were already there with me.
yeah. No, like this is what I wanted to know from you, because many of the students end up talking about difficulty in sustaining this amount of discipline. Now they get distracted by ABCD factors, then emotionally being vulnerable at times, going through highs and lows and all that. I am personally not able to relate to that so much because I'm not like so much emotionally driven person. But like, how have you been? I mean, you've done all this in very short period of time. So it's tough to do MBBS then MD. Now sitting for the next exam, so, and then you clear that exam, now entering into another 3 year course. So, like, you feel you look very sublime, you look very solid, disciplined person. Have you actually had your own like struggles, anything like from within inside that you had to overcome during this period?
Yes, there was a lot of struggle, I think, especially during the last 6 months of my preparation before my university exam, because it had come like a bit shocking for us that just 10 days after my
Yeah.
practicals, we are having NEET. And I had this rheumatology in my mind. So I was like very determined that no, I
Mhm.
want it this year only. So there were times when I felt overwhelmed and I used to cry a lot. And in the night, especially at 2 o'clock and all, when I'm studying in the library, I used to feel overwhelmed. But I had the support of my family, my
Mhm.
parents, my sister. They have supported me like so much. I used to call them like night, maybe 2 o'clock, that I'm feeling overwhelmed, and they motivated me. My mother had come to stay with me during my exams,
Oh.
during my NEET PG as well as my university exams, to support me. So I had like family support was everything for me, and I think they are a like big reason behind this success. So I
Yeah,
owe
of course.
everything to them.
Yeah, it's obviously not possible to achieve anything of this kind without family support. Then, of course, like coming back to the core topic again about preparing during PG, I have myself got an idea that NEET test is unlike NEET PG, is not an exam where you require any specific preparation strategy and time. If you just do your course properly, watch few videos properly, and have a reasonable understanding of the study material, I think that is enough to actually crack NEET test. It's unlike NEET PG where you need a definite focused preparation. This much of focused preparation is not required for NEET tests. It's just part of the process. What is your
Yeah.
feeling about that? You need to actually stress about NEET tests too much.
So I don't think so. I think that in my second year, from my second year, when I got time in between, I saw your videos. I'll be very honest, I could not continue watching them. I just saw it for the topics which I felt difficult, and I read your notes. But I've read Harrison very religiously. I have read all the important topics from Harrison, all the clinical cases which I saw in my ward, be it
Yeah.
rheumatology, be it GMED. I always read that. Along with that, during initial second year I did not get time to solve that many MCQs,
Yeah.
but in the last, I think, 8 to 9 months of my preparation, I in the last 8 to 9 months I solved a lot of MCQs, and I think that has also helped me out to understand the pattern of questions which come. So I think you don't
Okay.
need to like go completely separate. You can read your books like Harrison and still you can crack it, especially the tables of Harrison, which were there in the MCQ solutions as well. They have helped me
Yeah.
a lot. So I don't think it requires a separate preparation. I think if you're very good as a resident, you're seeing patients, you're treating them
Yeah.
clinically, all these things you will remember like that only.
Exactly. And that is where I think this preparation strategy comes to the fore. Like you have videos with you, you have Harrison with you. Videos are also talking of the same topics that are written in Harrison. Videos may actually align with Harrison, sometimes not align with Harrison. So how do you actually take both this by? Because you've already prepared for NEET PG using Maros, you're very familiar with the app. So in what
Yeah.
way does the color of the app change when it comes to your PG course? How do you use it differently between UG and PG?
Sir, in UG, I think I saw all your videos. I have used Marrow during my UG as well.
Yeah.
So I have like
Yeah.
seen all your videos during UG, and at that time I did not go too much for the books and all. However, how much time I got, I did that. But in residency, I think there was not so much time to watch videos. So for
Yeah.
the topics which I felt were difficult, like for example, transplant medicine and all, which were a bit difficult, hemodialysis, for those topics, I have seen videos and I read the notes. I have read your notes for many topics or many more topics. But after that, when I saw any patient, I used to come back and I read it from Harrison as well. I kept it
Okay.
as the base. And then I read notes for all the important topics and the topics which I found really difficult because you explained them so well that it usually became very easy for me to understand.
So, like having used Marrow during your NEET PG preparation, does it actually help you so much? Because I feel NEET PG level understanding is good enough to solve almost 100 questions out of the 150 for NEET-SS, because many of the questions are generally like much better if you were at NEET PG, like environmental statistics and toxicology and all that. So, I think NEET PG level preparation really does help, right?
So it has helped me so much that I'll tell you that even in our NEET, we had questions which were on OBGYN, like
Yeah.
toxoplasmosis in pregnancy.
Yeah.
And in
Correct.
residency, I have not seen toxoplasmosis in pregnancy,
Yeah. Yeah.
but I
True.
recollected the answer I read for my NEET PG.
Yeah. Yeah.
So there were
Exactly.
a lot of things which I read for my NEET PG and I still remember. Even sir, during my residency, I like for example nephrotic syndrome.
Yeah.
I saw your videos when I was a UG. So I did not
Yeah.
see all those topics again because I knew the core concepts. I had
Correct.
read in second MBBS as well in Robbins. So I
Yeah.
remember all these things. So that is why it was very easy for me since I prepared so well for NEET PG during residency as well. And
Wow.
I
That's
think that
what.
it
So
formed a good base for me.
exactly. Now, what you are actually saying is what everybody should be doing, but I don't know why everyone is not able to do that. I have no idea. This is the what is the perfect person, like studying properly from UG. You read all the books, you watch the video, get ranked, then you join PG, then you again read, you watch the video. But I'm just asking you, like, out of my inquisitiveness, why are not people not able to do this? Is this a very tough task? What is your feeling? Does it require more discipline, or does it require more hard work, or does it require more talent, or what is that is actually required to execute this? Because the execution is where everybody is falling short. Everybody knows this is what is to be done, but unfortunately, only 1% are executing. So, what is that is required to execute this?
So I think first of all, hard work. Like I have studied like for very long hours. So hard work, there is like no
Yeah,
substitute for hard work.
exactly.
But I think
Yeah,
most of the medicals are very hardworking.
very
But
hard
apart
working,
from
correct.
that, I think it is like dedication. Like I never took
Yeah,
it as a burden. I studied it because I loved the subject. And
yeah,
sir, like when I was a UG since second year, it was my dream to take medicine because in my first posting only I decided that I want to do this branch. We have those clinical postings in
yeah,
our UG college. So there, when I
yeah.
went for my medicine posting, I decided there and there that I want medicine only. I love this branch. Until date, I love this branch. I'm very grateful that I got into medicine, and I think that dedication is needed, sir.
Wow, that's great. Now, like, see, in UG times, we generally don't know much about rheumatology, right? During UG, we have very little exposure to rheumatology. During PG times, and that too, only people in very few colleges actually get to see rheumatology cases. Only the big institute people are actually aware of rheumatology. Others know rheumatology mostly through the app. I had a student who told me even last time that he was thinking rheumatology is for rheumatoid arthritis. Only after seeing the chapter, the video, he understood that so many diseases are there in rheumatology. And he's grateful for that. So it's a very less known side. So just tell about how you were actually introduced into that, because usually I don't think you'll be knowing anything. So from PG, how you got interested in this and how it actually became a part of your life so much that you wanted to do this.
Yeah. So, sir, in UG, as you said, even I did not have any exposure. In PG, sir, in my college, we have a separate rheumatology unit, and I was a
Yeah.
registrar there. My guide runs is the head of that unit. So we
Okay.
had a separate OPD on Saturday where we used to see rheumatology patients. So there I
Okay.
got the exposure, and when I saw SLE patients with all the mucocutaneous involvement and
Yeah.
different various organ involvement, and after 6 months after taking cyclophosphamide and everything whatever we gave them, after that when they used to come to me and thank me, and when I saw them they were so better, it gave me so much satisfaction, and it was like so overwhelming to see them so happy. So I it was very rewarding for me. So I had
Exactly.
decided, like in a few months only in that rheumat unit, I had decided that I want to be a rheumatologist, and then I presented papers and all those things in rheumat only. And my thesis topic was also of rheumatology on ankylosing spondylitis. So
Can you
I had a
brief
very
me
good
about your
experience.
thesis? Can you just brief me about your thesis topic on ankylosing spondylitis?
Yeah, it was clinical and radiological profile of basically spondyloarthropathy. So all were included in
Okay.
that, including yeah, psoriatic and everything, IBD related as well as post-infectious. So we had to with a 3 months follow-up. So on
Yeah.
admission, I used to check all their MRI, and I calculated their disease activity with ASDA score. I calculated their ASDA score, and after 3 months, I used to check that whatever medicine they are taking, whether they are taking
Oh, okay.
tofacitinib or
Yeah.
sulfasalazine, and after 3 months I again calculated their ASDA score, and then we checked that on which treatment there was more improvement using the ASDA
Wow.
score only.
Wow. Awesome. So you're already into the world of rheumatology. That's great. That's very nice. Actually, I'm also thinking of that because it I think it suits your personality also. No, have you thought that way? The subject actually suits my person because I don't think you like to like toil too hard and run from one department to the other. I think you'll be actually very happy in rheumatology. Rheumatology suits you the person also.
Yeah. Sir, I wanted a good work-life balance also in future.
Yeah.
So that was a point, but that came later on. But yeah, I think like I can do really good in the branch, and I have a lot of interest in it. So I'm
Yeah.
looking forward to like do super
Yeah, definitely. But
specialization.
there is heavy competition. I think over girl whom I'm meeting who's studying well medicine wants to do rheumatology. So I think there is going to be hefty competition between girls and rheumatology. I guess there is like tremendous amount of interest being generated. I am actually so happy because I am, myself not a rheumatologist. My rheumatology is all linked to the medicine thing, rheumatology. And of course, during nephrology DM, we've seen lupus nephritis and stuff, but generally it's the medicine thing. With that, I've been able to kind of inspire people to come to rheumatology is, I think, a very, very positive thing. I think it's more of a blessing rather than me doing something by myself. Okay, so now my question is about again what most of the people want to know. Like anybody who is in second year of MD is opening the app and seeing a lot of videos are there. Then he is already like kind of fed up after first year of work, and now opening the app, seeing all these videos in the platform, he's getting overwhelmed, and he's himself not in a position to do any position to decide what to do and what not to do. So if you are in their space and in a college where suppose I'm saying you have a lot of time also, then what would they do? When they open the app and they have the books, everything with them, how would you tell them? Just give them a plan what to do.
So if they are having time, I would definitely recommend they should watch videos, because if they are having like that much time, so I'm assuming that they are not seeing that many patients, so they should
Yeah,
actually see the video so that they get all
correct.
that. And with
Yeah,
the videos, I think they should do notes, but Harrison, I think still everybody should read it because it like helped me a lot, for basic concepts as well. And they were, I think all the questions were from Harrison only, especially
yeah,
environment and toxicology. So I think
yeah,
they should daily watch videos and simultaneously read it from Harrison as well. And when they are seeing any patient like on their daily rounds and all, they should dedicate some amount of time in the night to come and read how they could manage the patient better, and what were different options of management. That thing I think everybody should do in their residency, because it gives you a wider idea. And along with
yeah,
that, if they're having time daily, they should solve MCQs and give GTs like at least once in 2 weeks or once in a week.
yeah.
In third year, I feel they should do that.
Yeah. Easier said than done. I don't know how many of them will do this, but because they themselves feel this is too much of a task. But I at least urge them to kind of, as you said, watch or read from the topics that you've seen in the hospitals. If they don't do that, then suppose they're managing patients at a very mediocre level in their center, they continue to think mediocre and remain mediocre. So unless and until we branch out and we start to see, okay, this is what that happens, then it is of course fine. Rheumatology, you said, is very rewarding, but general parlance, general opinion about rheumatology is not very rewarding, because as you know, most of these diseases are, some of them are actually good because we've been able to kind of have drugs which we're able to conquer. But majority diseases are still, right? Mortality wise, not so much, but morbidity wise, quite a lot. So that is a kind of a difficult thing to, handle, and more so, you travel with the patient for a prolonged period of time, because patient comes today and then you are with the patient for induction and maintenance and then further and further. So, have you actually thought about it? Like, how would it be in that case?
Yes, like many people have told this to me as well, that you feel the same thing, that you feel it is rewarding, but no, there is no cure for most of the diseases. But
Yeah,
I feel that even if I can make life of one single patient better, it is
yeah,
very rewarding to me, because for most of the branches, I feel so that once if a patient gets some disease, many times it is not curable. But if I can
yes,
make somebody better, the patient, like if we can treat them and diagnose it earlier, because I want to spread
yeah,
awareness about it as well, because I'm so
yeah.
interested in it. So I think that is like very nice for me. I'll be very happy to do that.
Exactly. See, unlike in the past, like numbers have improved drastically. 5 year survival of SLE is now 85, 86%. That's not a small number. It was not like this 10 years ago. So, rheumatoid arthritis, if you find down time, you can actually cure the disease and bring the patient back to normal off drug. So, if you look at the two major diseases itself, numbers have improved considerably. A few diseases, of course, like scleroderma, polyarthritis nodosa, and all that, where numbers are actually bad. But then a lot of the other diseases, it is good. So, I'm actually very happy that you're very clear in your motive, going forward with respect to the course also, because confusions are what actually kill most of the students. I feel they have no clarity. I mean, I have come across this, and we are now struggling as such to kind of, what is it, inject some sort of clarity so that they make better decisions. What is your mantra for that? How do you get so much clarity? You meditate around, what is the secret behind clarity?
Sir, even I don't know, but like it's always been like that for me, that once when I decide something I want to do it, I do it with full dedication. I don't know, like
Yeah,
during my second year also, I developed interest in medicine, and it was so much that from my second year, I targeted that nahi, I need a good rank in NEET and I want
yeah,
medicine. And I did so. Even like in during my school time, like from 7th, 8th standard, it was like my dream to become a doctor. I got inspired by a lot of doctors. So I was like, no, मुझे medicine ही करना है, and then I prepared accordingly for NEET UG. But I think that it is my interest, sir. I really get
wow,
very interested. I don't take it as a burden, like studying or reading books or anything.
yeah.
I find it interesting that I'll get to learn more, I'll treat better, I'll manage better. So I
That's
like
the most
reading, I like
positive
studying.
attitude. Yeah, exactly. We learn something. See, if an engineer learns something, whether he can actually directly make a change in somebody else's life is a question mark. But we learn something, I think that may come of use to somebody the very next day. Maybe a small thing that we learn, but how much of a difference that can make. Maybe a small dosing adjustment we learn, and we make the dosing adjustment, and suddenly things start getting better. I think that is the pump of this. But again, as I said, only people who have gone really hectic colleges and worked in real tough departments will know what she's talking about. I don't know others how, to what extent they relate, is a question mark. Now, again, coming back to the exam, just solving MCQs and nearing end of preparation. That's what people are talking of. Last 1 month or so, like how you balance notes, question bank, test series, GTs, etc. The last 1 month of preparation.
I'll be very honest. I had my university exam in
Yeah.
November. Before that,
Yes.
I was solving MCQs, giving grand tests, but it was from 29th November to 5th of December, my university exams.
Yeah.
So 15 days prior to the exams, I stopped solving all MCQs. I was preparing for that. After
Yeah.
that, I
Yeah.
have my practical on 16th of December. So
Oh.
post my theory exam, 5 days, I solved MCQs. I gave two grand tests. I did not
Yeah.
score very well in the grand test, so I
Yeah.
was a little bit my confidence went down. But then I tried to motivate myself that no, it's okay, I'll get back on track. Then the
Yeah.
last before like from 10th onwards, 10 December, I was preparing for my university
Yeah.
practicals because it was a
Fine.
very big thing for me. 16th,
Yeah. Of course.
as I finished my practicals, from 17th, I again started. Started solving MCQs. I again gave two grand tests, and
Yeah.
I knew like in the previous grand test, I knew the topics which were on weaker side, so I tried revising that. Also, I had a like a kind of 20th notebook for me. So
Yeah.
whenever I solved MCQs, like I did that for my NEET PG as well. Whenever I solved MCQs in my third year, I made a list of few topics which were difficult and which required multiple revisions. For example, antibodies in rheumatology,
Yeah,
and in hepatology, the hepatitis B and C. These kind of
yeah,
things which I think I forgot frequently and which were like a bit memory based. I had written them the topics, and those topics I
yeah.
revised in the last 10 days. Also, one more thing I did which helped me a lot in residency. I forgot to mention it before, that whenever I read some topic and I felt that there is some criteria or something which I'll forget, for example, steroid criteria for PCP. The day I read it, wrote it on a post-it and I stuck it on my wall. So, like, I
Okay.
used to revise it. I used to do that for many topics. So, my wall was filled
Yeah,
with all those small, small post-its. And
yeah,
2 days before NEET, I just revised those topics and like
yeah.
criteria for AVR, MVR. So, all these small
Yeah.
things which we tend to forget, I wrote it on a post-it when I studied it during my residency itself and stuck it on the wall. It really helped me a lot, sir.
Wow. This is, I think, the interview that I've done last year also, I think the toppers were actually boys. So I think it's a long time since I've actually interviewed a girl topper. So these boys who get rank 1 and 2 or get in the rank inside top 10 are no way like you. They are different. They are very different. They're not as disciplined. They are not as systematic. I think they rely on so many other things. So what you're saying is I think the most ideal. I am thinking why you didn't get rank one. You should have got rank one, I guess, because this is the most ideal way that somebody can actually prepare. I don't think somebody can find a fault with respect to this. If you had gone for interview, I think for INA exams, they would have straight away given you first rank itself because I think they themselves would have got impressed. Being very good. But I think you're going you if you take up rheumatology with this much of a passion and this much of sincerity and dedication and devotion, I would say. I think, as you said, in community also, community-based rheumatology, especially most of the patients are females as well. You can make a lot of difference. You can single-handedly make a lot of difference because we know there are a lot of patients. Unfortunately, nobody's diagnosing. That's the problem. There are a lot of cases, but unfortunately, only I think 30% is being missed completely missed. So there is huge amount of what is it prospects with respect to that. And so again, finally, few words for people who are using the PG, I mean, using the app for PG. Like, what would be your, I mean, people who are actually having some reasonable time in final year, their final exam as well as the app and as well as the exam. How do you kind of tell them to dedicate their time?
Yeah, so I would say that please watch videos, especially of the important topics which have been asked in the last 2 3 years. The pattern is very unpredictable, so you can't predict it like beforehand, but
Yeah,
the core clinical concepts should be clear. So do watch it for important topics and the topics which you find difficult and the cases you don't see in your college. You should
yeah,
watch videos. You should read the notes as well. With that, please do read Harrison. Please see all the tables and diagrams of Harrison very meticulously. Environment and toxicology I read for my university exam, so hence the questions I can say were directly from Harrison. So
yeah,
please do read all the things, like don't leave something thinking that this is not important. Apart from that, do solve MCQs whenever you are getting time, because it challenges your brain to think that way, because the questions in the exam are never direct. They are like
yeah,
very twisted. So the more you solve MCQs, the better you will get. Apart from that, please give grant tests as much as possible, especially during the third year of your residency, because it tells you the topics which your topics which are weaker. So
yeah,
you can work more on that. So if you have that idea, even during the last few days, you can revise those topics which
yeah,
you tend to do wrong in your grant test.
yeah. So that's fantastic. I mean, it was awesome doing this interview. Like, so it's actually very rare for me to kind of get impressed with the person based on just their methodology, the way they approach the whole thing. Because we have, on the whole, I think most of us, including me, our approach is not very systematic. We have kind of an approach where sometimes it works, it doesn't work, etc. But yours has to work all the time. So once again, wishing you the very best going forward and hoping to see what is a standout rheumatologist from Maharashtra in future. So it was
Thank
great
you
talking
so
to you,
much.
Tanya.
Same here, sir. Thank you so much.
Okay, all the best.
Thank you.